Hey there everyone, and welcome to another video in our Flight Physiology and Human Factors series. In this chapter, we're going to look at accelerations in flight, and we're going to be talking about how different biodynamic forces can affect the human body in flight. So our chapter objectives here are number one, to define the different kinds of acceleration and the forces that are involved with those accelerations. And this is going to include a discussion on positive and negative G's. Secondly, we will examine the effects G-forces have on human physiology, especially with respect to blood flow and oxygen delivery to the brain and other organs that we have talked about before. And finally, we want to be able to understand the basics of blood flow in the human body and how G-forces can disrupt it and produce the effects of stagnant hypoxia. So what sorts of outward symptoms can we expect when you are undergoing these G-forces? So gravity and acceleration forces can affect many aspects of human physiology. And of course, this is not to forget that the human body is always being subject to gravitational force, even when you're not in an airplane. Now, gravity has effects on pretty much all aspects of human physiological function, but particularly blood flow. And when we talk about gravitational forces in flight, those are primarily going to affect blood flow. Now, if you go back to chapter 4, we certainly learned a lot about oxygen transport in the body, the role that blood flow plays into that. We talked about how blood, one of its major functions is to transport oxygen to tissues like the brain that need that oxygen to make energy for themselves. And we talked about the different kinds of hypoxia and how severe hypoxia can lead to pilot incapacitation and even death. So in this chapter, we're going to kind of take the same approach in that we're going to be thinking about these sorts of things through the lens of oxygen delivery to tissues in the body, but the hypoxia that we're going to see is not going to be a matter of oxygen not being available like we saw with altitude. It's going to be a matter of blood that is rich in oxygen not being adequately delivered to tissue because it's being subject to these biodynamic forces. So we're going to learn how the body responds to these different types of forces. And then in the next chapter, we're going to start looking at how these forces and how doing things like taking heavy banks or turning or flying inverted, how these things can affect our sense of spatial orientation. So for now, our focus is going to be on the effects these forces have on the body. Okay, so to adequately prepare you for these conversations, let's have a very brief overview of the cardiovascular system. So the heart itself, and you know where your heart is, it's kind of right in the center of your chest, what we call the thoracic cavity. The heart is a four-chambered organ, but for our purposes, we're going to split it up into a right side and a left side. So the right side of the heart is going to be the side of the heart that deals with deoxygenated blood, meaning blood that does not have a very high content of oxygen. So when I show blue arrows like this, that is meant to show that the blood flow that is occurring with oxygen poor or deoxygenated blood. So the purpose of the right side of the heart is to pressurize and pump this oxygen poor blood to the lungs, where we learned in chapter 4, we inflate our lungs and oxygenate that blood that is flowing through those pulmonary capillaries. And then through the pulmonary veins from the lungs, this blood flows back to the left side of the heart. And you can see the arrow has changed color here to indicate that the blood that is flowing from the lungs to the left side of the heart is now oxygen rich. The left side of the heart will then pressurize and pump this blood out through the aorta and many of the major arteries to all of the systemic cells and tissues of the body. So this will include the brain, the liver, skeletal muscle, the skin, all sorts of tissues and cells that need that oxygen in order to function properly. So this is going to occur through capillary beds that perfuse throughout all these different body cells and tissues. And then those capillaries will branch into the body's veins and then eventually the vena cava, which is going to carry this now oxygen depleted blood. Keep in mind, we're oxygen rich over here and oxygen poor over here, which indicates that the difference is that the oxygen that was in the blood and the arteries was delivered and consumed by the body cells, which explains why we're now oxygen poor again. So that oxygen poor blood will return back to the right side of the heart through the veins and the vena cava. So this is a closed circulatory system, meaning the blood is constantly flowing in a loop. Blood can neither escape nor enter. So in order for us to oxygenate blood and then deliver that oxygen-rich blood to all of the body's tissues, including the brain, we are dependent on this flow of blood continuing uninterrupted. And that is going to be the key. We do not want an interruption of blood flow, but that's exactly what we're going to see when we start looking at these G-forces. So what is it that actually causes the blood to flow? What actually is the driving force that gets blood to move from the heart to the lungs, from the lungs back to the left side of the heart, and then from the heart out into all the different tissues of the body? Well, the actual driving force is actually fairly easy to explain. So if you think of the heart as being like a big pump, the purpose of a pump is to generate large amounts of pressure. So the heart, which is made up of a type of muscle called cardiac muscle, that cardiac muscle contracts and essentially puts on a squeezing force on the blood that is contained within those ventricular chambers of the heart. So basically that muscle contracts and squeezes and pressurizes that blood that's in the heart. That drives up the pressure, so that's what this P high is meant to indicate. It is at a high pressure, this blood that is inside the heart. And then the idea here, the physical explanation, is that any fluid, and that includes blood, any fluid will flow from areas of high pressure to areas of low pressure. So if you pressurize the blood that is in the heart, that high pressure is going to force the blood to flow towards the areas of low pressure. So that's going to include the arteries and the tissues. So when we pressurize that blood that is in the left ventricle of the heart, that blood will then shoot or move through the arteries to the different tissues here. So this container here is meant to represent, say, the brain, the muscle, or some different tissue in the body or some organ of the body. And the amount of blood that that tissue receives is going to be very much dependent on this blood flow occurring uninterrupted, okay? Now, the idea here is that if we include a gravitational force that is pushing in an opposite direction to the way that blood is flowing, that blood flow is not going to occur quite as well as it did without the gravity. So if gravity is working against the flow of blood, then the tissues are naturally going to receive less oxygen-rich blood, and the body, as we will see later, is going to have to compensate for this and get the heart to work harder so that it can pump that blood against the force of gravity. And it's beyond the scope of this class, but there are actually some anatomical differences in the blood vessels that exist below your heart versus those that exist above your heart, because the vessels that exist above your heart return blood to the heart with the flow of gravity, whereas those that are below your heart have to pump up against the force of gravity. So as for biodynamics, which is a subdiscipline of the field of physiology that we've been focusing on all semester, this field is going to examine the effects that changing acceleration, which we're going to call G-forces, actually have on the human body. And as you can kind of picture by now, these effects on the human body are mostly going to relate to blood flow. So these G-forces themselves can vary in their intensity, how strong they are, their duration, how long they last, and the direction that they occur. So not every G-force that we're going to see is necessarily going to be pushing in the same direction that gravity attracts us towards the surface of the earth in. So that's something for us to consider as well. And the other thing to consider is that you might think of pulling G's or these G-forces as being something that only acrobatic pilots are really going to experience. Well, G-forces is something that all pilots should learn about because all pilots are going to be subject to G-forces at some point in their flying career. So you need to know what to expect and what it is exactly doing to your body. So, over the years, aircraft design has improved to allow the airframes to withstand greater amounts of gravitational strain. So, airplanes are just built better than how they used to be. And the benefit to this is that airplanes are much more reliable, they're much more sturdy, and they can hold up to the stresses of flying through the air at high speeds compared to how it used to be. So, we've mentioned before how back in World War II, a lot of airplane accidents were occurring just because of the poor and shoddy design of the airplanes themselves, more so than pilot error. But things have shifted in recent years so that now airplane accidents occur almost exclusively because of human error and less so because of mechanical failures. Well, obviously, the benefit here is that airplanes are now more sturdy and more reliable compared to how they used to be, and they can sustain more gravitational strain compared to how they used to. But the downside is that the human operator now has to be subject to that same gravitational strain. So, after several reported incidences of what we'll call G-induced loss of consciousness, or G-LOC, James Doolittle back in the 1920s, and this was obviously very early on in this field, attached an accelerometer to his biplane to measure G-forces in flight. So this was kind of the first instance of someone making the connection between flying an airplane and subjecting oneself to these gravitational forces. So this is really the first connection that we made between the idea of pulling G's and the potential ill effects that this could have on the human body and the pilot as the plane is being operated. Okay, so let's make a couple of definitions here. So, acceleration is the measure of the change in velocity over time. It is measured in units of meters per second squared. So, velocity is a vector component that consists of both speed and direction. You can talk about your speed. So, you can say you're going 60 miles an hour, or 100 miles an hour, or 200 miles an hour. Well, velocity includes not only the speed aspect of that, but also the direction. You can be velocity would be flying 100 miles an hour or 200 miles an hour at a heading of 0 or at a heading of 20 or of 0 to 0. So velocity includes both speed and direction. So if we work that backwards and go back to acceleration, acceleration is the measure of the change in velocity over time. So it includes not only a change in speed, but also a change in time as well. So there are three types of acceleration that we need to consider. There is linear acceleration, which is just a change in speed, radial acceleration, which is just a change in direction, and then much more commonly, you're going to see angular acceleration, which includes both a change in speed and direction. Now, when we're talking about the actual G-forces, colloquially, if someone says they pulled 4 Gs, what that really means is that their body experienced 4 times the gravitational force than they normally would have experienced. So when you're standing on terra firma, when you're not in an airplane, you are always experiencing 1 G. That is 1 times the equivalent of Earth's force of gravity. So an object on rest on the Earth's surface will experience 1 G, which is equivalent to 9.8 meters per second squared. Another way of thinking about that is that if you stand at the top of a building and drop a bowling ball off the top of that building, that bowling ball, from the moment you drop it, will accelerate at 9.8 meters per second squared, meaning after 1 second after you drop it, its velocity will be 9.8. After 2 seconds, it will be 19.6, and so on and so forth. After every second after you drop it, it's going to accelerate by that amount. So pulling 4 Gs would produce an experienced gravitational force of 39.2 meters per second squared, so 4 times the equivalent of Earth's gravity. So weight is actually just a force, a gravitational force, that is exerted on an object on Earth's surface. So weight is equal to mass times the Earth's force of gravity. So a 180-pound man that is pulling 4 Gs would feel as if he weighed 720 grams, which is 4 times 180. So the g-force that you actually experience is expressed as a ratio over the normal gravitational constant of 9.8. So the g-force, or capital G, is equal to the applied acceleration divided by little g, which is that 9.8 figure that we just had. So if the aircraft that you're piloting accelerates in any particular direction, then you, the pilot, will experience or pull positive or negative G's depending on the direction of the force, okay? So little g, the gravitational force due to Earth's gravity, is always going to point down towards the center of the Earth. But the applied acceleration can point in any particular direction at all. So that's going to complicate these calculations a little bit. We're going to simplify things for the sake of keeping things simple, but that's the basic idea. Okay, so like I said, those applied acceleration forces can be applied in any three-dimensional direction, any 360-degree direction you can imagine. So the pilot can experience g-forces either positive or negative in one of 3 directions. You have longitudinal forces, or g sub x, lateral forces, g sub y, and then vertical forces, g sub z. So if you look at the diagram here, G sub x forces are going to be forward and backward. So these are going to be the kind of forces that you experience when you rapidly hit the thrust or hit the brake. Okay, so you'll either jerk forward or jerk back in your seat. Lateral forces are side to side, so you are very rarely going to experience these. You really would only experience these in an airplane crash, so hopefully you won't ever have to experience that. And then the vertical forces, the g sub z, are the up and down forces. These are going to be by far the most common gravitational forces that you will encounter in your flying career. And that's going to be what we focus on moving forward. So because these GZ forces are the most common, they provide the greatest potential danger to blood flow to the brain and to the retina. So your brain is obviously in your skull. So if you experience positive G's, that is pulling blood down away from your brain. So that obviously presents a challenge. So positive GZ forces are going to reduce blood flow to the brain and to the eyes. And you'll recall, hopefully, that we've talked several times about how the retina has the greatest oxygen requirement of any tissue in the body. So not only will your brain be affected, but your eyes will too. And then negative GZ forces that point in the opposite direction compared to Earth's gravity, these are going to increase blood flow to the brain and to the eyes. These are going to pull blood from your feet back up to your head. Okay, so let's talk some practical aspects about pulling these G's. So look at this diagram here. This is what looks to be a Cessna-type aircraft that is flying level. It is flying perfectly level. It is not banking at all. And because it is achieving level flight, the weight, which is the gravitational force that is pulling the airplane down to Earth's surface, is being perfectly balanced by the lift that is generated by the airplane's wings. So because these two vector forces are completely equal, the airplane stays in level flight and is not gaining or losing altitude. So ideally, this is how things should be for level flight. But this is only really going to be feasible if you are not banking at all. As soon as you start banking, this is going to start changing some of the vector calculations. Like I said before, weight or gravitational force will always point down to the Earth's surface directly. But the lift vector is going to be dependent on the angle of the wings, or the bank angle. So if you start banking, whether it's a medium bank turn or a steeply banked turn, like I said, this is going to change the lift vector. And now suddenly the lift vector is not going to perfectly balance the weight vector unless you start pulling back on the airplane's yoke, okay? So the issue here is because if you start banking and you don't pull back on the yoke, you're going to start losing altitude. And that's because you're generating less lift, and that lift is no longer sufficient to counterbalance the airplane's weight. So, in order to maintain level flight, you have to pull back on the yoke to generate more lift. But in doing so, to maintain level flight, this is going to generate a load factor on the airplane. And it's not going to be that severe, but you are going to pull positive G's in doing this. So you have to consider not only the load factor on the airplane, but the load factor is placed on the body of the pilot as well. And as you can imagine, the load factor, or the amount of G's that you pull, is going to be dependent on the bank angle itself, because the steeper the bank angle, the less lift your wings can ideally generate, and that's going to require you to pull back on the yoke even more, and that's going to generate that positive acceleration force that we just mentioned and put more strain on the human body. So you can actually calculate the amount of gravitational force being placed on you through this equation here. The GZ force is equal to 1 divided by the cosine of the bank angle. Now, certainly we're not going to turn this into a math class, but you can see here that at a 60-degree bank angle, that produces a GZ force of 2. So if you're banking 60 degrees and maintaining level flight, you can be assured that you are pulling 2 Gs. So in this graph, you can actually see the mathematical relationship between the bank angle and the load factor being placed on your body. And like I said, at 60 degrees, this G force is equal to 2 Gs. And at 0 degrees, it's equal to 1 G. So obviously, if lift and weight are perfectly balanced and you're in level flight, you're just pulling 1 G. But you can see that as you bank heavier and heavier, the load factor gets higher and higher until you eventually get to pulling multiple G's. So the lesson here is banks or turns should be done as gradually as possible to reduce the gravitational effect on the body and on the airplane. So really, anytime you're operating an airplane, you should obviously know the limits and design limitations of the aircraft, but also for your own body as well. Okay, so let's talk about pulling positive G's. So it's not just going to be turning or banking that produces positive G's. So pulling positive G's will produce a feeling of carrying extra weight. We've already established that, right? So in addition to banks, you're also going to pull positive G's when you're pulling up from a dive or an inside loop. So this diagram here is meant to show that you are diving towards the Earth's surface and then rapidly pulling up from that dive. So when you do that, you're going to pull multiple positive G's, and the diagram here is meant to show that this is pulling the blood down away from your brain and your eyes and towards the lower trunk of your body and towards your feet. So again, the thing to consider here is the cardiovascular system. Your heart is a pump. The purpose of that pump is to get blood to flow throughout the circulation. And oftentimes, especially when you're delivering that blood to your brain, that blood has to be pumped against the force of gravity. So when you're pulling positive G's, you are adding gravitational forces onto the normal Earth's gravitational force that is already there. And this gravitational force is pointed in the opposite direction from that blood flow that is going to your brain. So your heart already has to pump blood and work hard to get that blood to pump to your brain against the force of 1xg. So when you're pulling additional G's, this is going to cause the blood to backflow. It's going to cause the blood to not get delivered up to your brain, and instead that blood is going to backflow down towards your feet. And your heart, presumably, is going to have to work extra hard to overcome that. But because the brain is so needy and requires blood constantly, even being without blood for just a little bit, this is going to produce very serious consequences that we will talk about very soon. Okay, let's talk about blood pressure. You've likely heard about blood pressure in a number of different places. You've had it measured at the doctor's office. So anytime someone says, my blood pressure this or my blood pressure that, what they specifically mean, even if they don't mean it, is that they're referring to their arterial pressure. Now, you have several different kinds of blood vessels in the body. Arteries take blood away from your heart, capillaries deliver blood to your different tissues, and then veins return oxygen poor blood back to your heart. So, when you're talking about blood pressure, you're talking about your arterial pressure, the pressure of blood in your arteries that are carrying blood from your heart to your different tissues. So, what you're seeing here is that there is a relationship between the blood pressure and location within the body. The higher up in the body you are, the lower the blood pressure. The lower you are in the body, the higher the blood pressure. So, when you're pulling 1G like you are right now, just sitting on the surface of the earth, your brain has an average blood pressure of about 96 millimeters mercury. The heart is about 120, and then your feet is about 170. So you might think it's concerning that your brain has the lowest blood pressure, but that's actually okay because as it turns out, 96 millimeters mercury is plenty of driving force to get blood into the brain. So that's actually okay. What is not okay is when you are pulling 5Gs, that blood pressure in your brain drops to 0 millimeters mercury, which basically indicates that no blood is getting to the brain at all. So you can see that there has been a large increase in the blood pressure in the feet, and that is because all the blood that should be going to the brain is being directed to the feet instead because of that additional gravitational strain. So the blood pressure basically represents the driving force that delivers oxygen-rich blood to that part of the body. Do not forget, blood flows from areas of high pressure to areas of low pressure. So we need the pressure in the brain to be high enough to drive that blood through, okay? So the heart is at 120 and the brain is at 96. So that difference there is the driving force that is going to get the blood from the heart to the brain. But that applies at 1G. Now, 120 to 0 sounds like a good deal. It sounds like that is a bigger driving force, but it's having to overcome 5Gs, and it just can't do that. So when you're pulling 5Gs, or when you're pulling any positive Gs at all, there is less of a driving force to bring blood to the brain, so it gets far less blood delivered to it. And what blood should be delivered there is getting delivered to your feet instead. So hopefully it doesn't take too much imagination to see that that is a big problem, okay? So we don't want to forget that the purpose of delivering oxygen to all these different tissues in the body, especially the brain, is that these tissues, these cells, these organs, they need energy in order to function. And oxygen allows them to greatly maximize their energy production, especially the brain and especially the retina. They are very energy costly activities that they do, so they need as much oxygen as they can get. So we've learned in previous chapters that the two most sensitive tissues in the body to hypoxia are the brain and the retina, especially the retina. We have seen that with hypoxia, the very first symptom that you're going to notice of hypoxia is diminished night vision, and we've covered that before. So it really shouldn't come as much as a surprise that the two most dangerous potential consequences of pulling positive Gs are loss of vision and loss of consciousness. So with loss of vision, it's because of a lack of blood perfusion into the retina. And then with the brain, not hard to imagine that not getting enough blood to the brain is going to lead to loss of consciousness. And even if it's not that bad, you're definitely going to have cognitive effects. So let's start with vision. So this is going to sound like kind of an odd place for us to start, but let's talk about what's called intraocular pressure. So the fluid that is inside the eye, whether you're talking about the aqueous humor in the anterior segment or the vitreous humor in the posterior segment, that fluid that is inside the eye generates an outward-facing intraocular pressure of about 20 millimeters mercury. The reason why this is important to bring up is because this pressure actually opposes any blood that is flowing into the retina. But because the blood pressure in this part of the body is pretty close to 100 millimeters mercury, blood is still able to get into the retina and nourish those rod and cone photoreceptor cells because 100 is still quite a bit larger than 20. So, to properly perfuse the retina with oxygen rich blood, the blood pressure that enters the retinal arteries needs to exceed that 20 millimeter mercury threshold. And usually it does quite comfortably when you are pulling 1G. Now, like I said before, we've seen in previous chapters that a loss of night vision is kind of the earliest symptom that you're going to see for hypoxic hypoxia due to the retina's heavy reliance on oxygen. So, a graded loss of visual acuity that accompanies pulling positive Gs is what we call gray out. Okay, so we're not quite talking about blackout, which would be the complete loss of vision. This is just a diminishing of your ability to see very well. This is going to be your first early warning sign for you're pulling too many Gs. And usually when a pilot starts experiencing gray out, they take it as an immediate sign that they need to kind of ease up on the stick a little bit, and usually those symptoms will resolve themselves very quickly. So gray out is usually going to occur between pulling 3 and 4 Gs. So if the retinal blood pressure falls below the intraocular pressure, and remember, when you start pulling Gs, the blood pressure higher up in your body around your brain and around your eyes, that blood pressure starts to fall. If that blood pressure falls below 20 millimeters mercury, you're no longer going to be able to drive blood past that intraocular pressure and into the retina. So if that happens, then you're definitely going to experience blackout, which is the complete loss of vision. Usually this is your most dire warning that not only are you experiencing visual hypoxia, but G-lock is going to happen very, very, very soon. Okay? So when we're talking about gravitational forces and hypoxia, we are specifically talking about what's called stagnant hypoxia. This is the type that occurs when blood flow is disrupted. We can distinguish this from the type that we talked about in chapter 4, which was called hypoxic hypoxia. Hypoxic hypoxia is your altitude-related hypoxia that occurs because you have ascended to high altitude, the air pressure is up there is lower, and you're just receiving less oxygen in through the lungs. Here, presumably, we're receiving enough oxygen, it's just not being delivered very well because of problems with blood flow. So, with gravitational forces, stagnant hypoxia occurs because of disruptions or interruptions in blood flow, and blood will pool in locations away from the tissues that need it, like the feet is where it would pool, as we have seen. So at about pulling 5 Gs, the brain is no longer going to receive anywhere close to adequate blood flow, and consciousness is going to be lost. So you cannot pull any more than 5 Gs without training or without G-suits, without losing consciousness. So this G-lock has 2 major stages to it. The first is absolute incapacitation. This is a total loss of consciousness that lasts about 12 to 20 seconds. After that is a relative incapacitation, which includes you're no longer totally unconscious, but you've woken up and you're mentally confused and a little bit disoriented, and this can last 12 to 16 seconds. Now, you might be thinking, well, these two things seem out of order. Why would the more serious sounding one happen first and the less serious sounding one happen second? Well, 2 things to that. Number 1, the really bad thing happens first, and that's because, again, you have completely lost consciousness. But the reason why that only lasts about 12 to 20 seconds and then you kind of wake up from that is because when you are completely incapacitated, you're going to naturally relax your grip on the controls, whether it's the stick or the yoke. So when you are completely unconscious, you'll let go of the stick and you'll stop pulling all those Gs, and that will start to restore the blood flow because your body is no longer being subjected to those gravitational forces. So once you wake up from that absolute incapacitation and you're not pulling those Gs anymore, you still have to deal with that stage of relative incapacitation, which is going to take some time for you to kind of recover from. So what is clear from this discussion is that the real danger of this gravity-induced loss of consciousness is the loss of aircraft control that it implies. So, relative incapacitation, the second stage, is particularly dangerous because the pilot, even though they've woken up, is not in a mental state to be able to rapidly regain control of the aircraft. And sometimes the real danger is that they experience some retrograde amnesia. They can't remember how they got there or what the nature of the gravity-induced incident was. So that's particularly scary because, as you can imagine, it really doesn't take that long for an airplane to crash once you have lost control of it. We saw that in chapter 1, I think it was. We saw that it really only takes about, what was it, like 79 or 179 seconds for an airplane to crash after you've first lost control of it. So when G-lock does occur, the pilot will almost certainly, like I said, relax their grip on the controls, which will reduce the G's and restore normal blood flow quickly. Still, if you add everything up, 24 to 36 seconds is still plenty of time for a plane to crash if you are not being careful. Now, we say all of this as if the body has no agency here, but thankfully that is not completely true. The body does have ways of adapting to changing conditions, which includes gravitational forces. So the body can compensate when necessary, but the unfortunate thing here is to a very limited degree. Now look at this diagram here. This is showing you a very common thing that I teach my human physiology students when we talk about blood flow in the human body. Two different aspects here. You have a person that is lying down completely flat, and then a person that has just stood up. When you are lying flat, gravitational forces are pulling down kind of from your back towards the ground. So your brain, your heart, and your feet are all equally subject to gravitational force. So you can see they all have an arterial pressure of 90 millimeters mercury. Now when you stand up, now suddenly gravity is pulling from your head down to your feet rather than from your back to the ground. So this is going to naturally pull blood from your head to your heart to your feet. So you can see now there is a difference in blood pressure that is related to top to bottom, as we saw before. So your body is constantly exposed to varying gravitational forces when you transition from lying down to standing up. So this is the explanation for why if you stand up too quickly from sitting down or lying down, you might feel a little dizzy at first, but that dizziness only lasts a couple of seconds because of this compensation we're about to talk about here. So when you stand up and feel dizzy, your blood pressure in your brain is momentarily a little bit too low, and you start to feel dizzy because your brain's not receiving enough oxygen. So the compensation is that your heart beats faster so that we can pump the blood a little bit faster and get that blood pressure back up in your head. So the way this actually works is your body is constantly measuring the blood pressure in your arteries through what are called baroreceptors. And we can break this down to say that baro is a prefix that refers to pressure. So a barometer measures pressure. So these baroreceptors are nerve cells in your carotid artery and in your aorta that are constantly measuring the pressure of the blood moving past there. And then these nerve fibers will enter into your brainstem into a place called the medulla. So anytime these baroreceptors that are located here and here, anytime they detect a drop in blood pressure that is not desirable, they will send electrical signals through these nerve fibers into the medulla, which is in your brainstem. And then the medulla will process that information and basically figure out that, oh, okay, we're dealing with low blood pressure, so we need to do something to raise that blood pressure. So the medulla will orchestrate signals to be sent back out the other way using your sympathetic nervous system. Those signals will go to the heart, and the heart will be instructed to beat faster and beat harder to increase blood pressure back up to normal levels. Another signal that we will see is that blood vessels will be instructed to constrict, which will also increase the pressure as well. So that is the body's natural compensatory response to a drop in blood pressure. So when you experience positive G's and your blood starts to pool in your feet, your body will detect that as a drop in blood pressure, and your body will attempt to get your heart to beat faster in order to compensate. Now, the problem, as I said, is this compensatory mechanism is extremely limited, and it is not at all designed to deal with extreme G forces. Now, this graph that we're looking at here is going to show you 4 different journeys through G forces. They are labeled A, B, C, and D. And basically, not to tell you what sort of conclusion to take from this, but basically, the conclusion you should take from this is that because our body's compensatory mechanism is so limited, we should expose our body to G forces as gradually as we possibly can. Okay, so let's start with graph A. Graph A shows us a pilot that is pulling extreme Gs, so almost up to 9 Gs, but they do not experience symptoms because the duration was very, very, very short. So they pull 9 Gs, but this all occurs within the time frame of only about 5 seconds. So they stay on this part of the graph. If any of these pilots cross over into this part right here, they will experience gravity-induced loss of consciousness. So if that pilot had pulled 9 Gs for 10 seconds instead, they definitely would have lost consciousness. So the reason why that pilot did not lose consciousness because they pulled Gs for such a short period of time is because of what is called the oxygen storage buffer. This refers to oxygen that is dissolved in the fluids of the brain and retinal tissues that provides just enough oxygen to get you by for a couple of seconds when you interrupt blood flow to the brain and to the eyes. So that is only for a very short period of time, so it is definitely not something to count on too much. Graph B, which you can see here in red, shows us a pilot that is pulling extreme Gs, but for too long. So they proceed without any warning at all to gravity-induced loss of consciousness. Now, when I say without warning, I'm referring to the fact that they pulled such extreme Gs that they did not even have the opportunity to experience visual symptoms first. We said before that gray out and blackout are your early warning signs that you're about to lose consciousness and that you're pulling too many Gs. But because pilot B pulled such extreme Gs and for such a long period of time, they went right to a loss of consciousness without experiencing visual symptoms first. Now, graph C shows a pilot that is experiencing a moderate onset of positive Gs, which does allow for visual symptoms to act as a warning. So if this pilot is just kind of gradually and linearly experiencing these positive Gs, first they will experience gray out and then blackout and then gravity-induced loss of consciousness. Now, clearly, graph D is showing you how you should respond when you first experience that gray out symptom. So this pilot very gradually is pulling Gs over a long period of time, and as soon as they cross this threshold and start to experience gray out, you can see they pull back on the stick and reduce the gravitational strain, and then they get back on the right side of the threshold there. So ideally, that is how you would respond. As soon as your vision starts to go, that is your warning sign that you are pulling too many Gs and you need to stop. Now, we haven't really talked much about negative Gs, which are far less common, but negative Gs will make you feel weightless as opposed to positive Gs, which make you feel heavier. And then negative Gs will actually cause blood to pool in your brain and in your eyes, as opposed to positive Gs, which pull them down towards your legs from your head. So you will feel this when you push down on the stick or the yoke into a dive or from an outside loop. And the diagram here is obviously showing you that the gravitational force is pulling up and the blood pools in the upper part of your body. Now, the math here is kind of funny, and we're not really going to get into it, but essentially, negative 1g will be twice the magnitude of 1gz, but in the opposite direction. So if you're pulling negative 1g, that actually means that the magnitude is twice that of Earth's gravity, but because it is balanced out by Earth's gravity pointing in the opposite direction, like I say, the math is funny, so I wouldn't worry about it too much. Okay, so let's talk about the physiological consequences of pulling negative Gs. Now, blood accumulation in the head may sound like not that big of a deal. You're probably thinking, oh, well, the brain and the eyes need blood and they need oxygen anyway, so what's the big deal with them getting more than what they need? Well, there actually are some pretty nasty symptoms that come from this. So, having too much fluid, including blood, in the brain is going to cause swelling, which is sometimes called edema. So, blood vessels are a little bit leaky sometimes, so they leak fluid out. So if there is too much blood in a particular area, that tissue is going to experience swelling. We will also see sinus congestion, headaches, and bulging eyes. So having all of your blood rush to your head is actually an extremely uncomfortable feeling. If you've ever stood on your head or hung over the side of your bed with your head facing down towards the ground, it's not a comfortable feeling. So the body's tolerance for pulling negative G's is actually generally less than for positive G's. Your body will actually tolerate positive G's much better than it will tolerate negative G's. So in normal flight operations, negative G's are really unlikely to ever be encountered unless you're an acrobatic pilot, but this is still very useful to talk about. So at about -3 G's, a pilot becomes at risk for what is called red out, which is obviously different than gray out or blackout. And this is called red out because of all of this blood rushing into your eyes and your retina. So this will involve visual blurring and seeing through a red haze due to the density of blood flowing through the eye. So if you're literally seeing red, that's generally an indicator that you've got too much blood flowing through your retina. Now, certainly we can have physiological compensation in much the same way that we did for pulling positive G's. So if you're pulling negative G's, the blood pressure in your brain and in your eyes is actually too high as opposed to too low for positive G's. So the body will compensate for high blood pressure in very much the same way that we saw for low blood pressure, just the opposite way. So the medulla, when it receives signals from the baroreceptors saying that the blood pressure is too high, it will send signals to the heart through the parasympathetic nervous system, and this will slow the heart rate down. So that'll decrease the rate of blood flowing through the body. It'll decrease the blood pressure. The arterioles will be allowed to dilate, which will relieve the blood pressure as well. And the overall systemic effect is that we reduce blood pressure and reduce blood flow. But obviously, same lesson here is that the physiological compensation mechanism here is extremely limited and it is not designed for pulling extreme G's. So it is not something to count on when you are flying an airplane. Okay, and then we're getting pretty close to being done. Let's talk a little bit about G tolerance and things to consider when you are flying and thinking about gravitational forces. So pilots will have individual physiological differences that make them less or more tolerant to experiencing G forces in flight. So the first one, if you've been paying attention, might be kind of an obvious one. How tall are you? The very tall have a much greater distance between their brain and their heart compared to somebody who is short. So therefore, for like me, for example, I'm a pretty tall person. I'm 6'4", so my blood pressure in my brain is much likely lower than the blood pressure of somebody who is, say, 5'6". So as someone who is very tall, if I were to fly an airplane, I would be much more susceptible to positive G-forces than somebody who is much shorter than me. So altitude hypoxia is something to consider. So there's no rule saying that you can only experience one kind of hypoxia at a time. So the effects of stagnant hypoxia that result from pulling positive G's will actually be exacerbated if you are flying at high altitude and experiencing some form of hypoxic hypoxia. So those two things can definitely stack and compound together. Blood pressure is something to consider. So people with low blood pressure, which is called hypotension, have a lower tolerance for pulling positive G's. People who are anemia, which can manifest itself as not having enough red blood cells, not having enough iron to carry oxygen around. This can compound the stagnant hypoxia by making delivery of oxygen more difficult. Someone who is hypoglycemic, meaning they have low blood sugar, means that tissues in the body will have less fuel to work with to make energy for themselves. And this is especially true for the brain because the cells of the brain actually can only work on blood sugar. That is the only fuel that they like to work with. Histotoxic hypoxia can be an issue. So, whether you're talking about carbon monoxide poisoning or any kind of drug or medication that interferes with circulation, this can reduce G force tolerance as well. So, this would probably most practically apply to people who are smokers and experience some level of carbon monoxide exposure all the time. Fatigue can be an issue. So, if you've missed meals, which is going to produce hypoglycemia, or if you're experiencing excessive noise, which can cause some fatigue, and we talked about that in chapter 7, or extreme temperature, these can all make you more susceptible to feeling the effects of gravity. And then finally, one of the most important ones is just experience with it. So having experience with G-forces can really be a major difference. So there is actually a lot of evidence that suggests that training yourself to become more tolerant to G-force can be highly effective in strengthening your resistance to it. So somebody who is totally inexperienced with pulling G's will be much more susceptible to pulling to the forces of gravity than somebody that actually has experience with it. So with all that in mind, how can you avoid G-induced incapacitation or G-lock? Number one, avoid pulling G's altogether. So do whatever you can to mitigate gravitational forces. So these gravitational forces are unlikely to present themselves as an issue to you as long as you don't go looking for them. So military and stunt aviators are much more likely to deal with them. So as long as you are maintaining level flight and not banking too hard, you really shouldn't have to deal with G-forces too terribly much. Now, of course, we mentioned the experience issue and the training aspect. Getting experience and training with G-forces can definitely be the way to go. There is an anti-G straining maneuver called grunt breathing that is described in your textbook. And as somebody who is not a pilot myself, I will admit I have never heard of this before, but it is in your textbook if you want to take a look at it. Recognizing the signs of excessive G-forces in flight is definitely an aspect to consider. As we said, you definitely want to look for visual symptoms first as a warning sign that you're pulling too much G's. And then another thing that we'll talk about is anti-G suits, which can be worn by pilots that know they are going to experience very extreme levels of gravitational strain. So these suits consist of inflatable rubber bladders in the legs that will fill with air that corresponds to the number of G's that someone is pulling. And what this essentially does will counteract the pooling of blood in the legs by squeezing the blood back up towards the brain. Now, this is not a foolproof thing in that it is only really effective of adding up to 2 G's worth of tolerance. So with an anti-G suit, 5 G's would affect you kind of more like 3 G's would. All right, that is going to wrap up this chapter. I hope you learned a lot. Thank you for your attention, and join us next time for chapter 9, and we will start talking about spatial disorientation. So long.